Do you have undiagnosed lower abdominal pain? Then you may have pelvic congestion syndrome. Pelvic congestion syndrome is a varicose vein develop inside the pelvic region. When the varicose vein develop into the leg region, it's visibly seen externally into the leg region, but into the pelvic region, this dilated refluxing vein is hidden because of surrounding organs. So first let's understand what is a pelvic congestion syndrome. Female patient presented with a lower abdominal pain, and this pain is more aggravated into the standing posture and relieved into the sitting or lying down posture, and definitely this pain is more during the menstrual cycle days. So these are typical characteristic of the pain into the pelvic congestion syndrome. Now let's find out what is the reason of developing the pelvic congestion syndrome. So when the varicose vein develop into the leg region, it's externally visible, but similar etiological varicose vein develop into the pelvic region, it's hidden because of the surrounding organ. Pelvic region has a vast this venous network, and because of the most of the time because of the multiple pregnancy, these valves of these pelvic veins are failed, and because of this damaged valve, reflux started into these pelvic veins, and because of this reflux, pelvic veins dilated, and the pressure inside the pelvic veins is increased, which leads to inflammation. And depending on which organs is involved by this dilated refluxing vein, symptoms starts. In pelvic congestion syndrome, symptoms develop depends on which organ is involved. If this dilated refluxing vein is surrounding the anal region, then hemorrhoids develop. If this refluxing dilated vein surrounding the bladder or the bowel region, then irritable bowel or irritable bladder syndrome develop. If this dilated refluxing vein is surrounding the uterus, then dyspareunia develop. And many times this dilated refluxing vein escape the pelvic region, and it gives a varicosity into the vulvar region or buttock region or upper thigh region varicosity. So in pelvic congestion syndrome, symptoms are different, and it depends on which organs are developed. And gold standard investigation is a transvaginal ultrasonography. By doing a transvaginal ultrasonography, wherein when reflux can be identified, and if it is present, then coil embolization and sclerotherapy is ideal treatment for ovarian reflux. Along with this ovarian reflux, if there is a etiology of nutcracker syndrome or the May-Thurner syndrome, then metallic stent should be used to relieve this stenosis. So in nutshell, pelvic congestion syndrome is a varicose vein developed inside the pelvic region. It's hidden because it's not visibly from outside, but it gives very significant symptoms, and it should be treated as early as possible.